Hi, this is Dr. Alan Gruning and welcome to my blog. Today I'm going to be discussing defeating pain with lifestyle changes. So this is a very interesting subject because I have a free medical clinic where I take care of people with acute and chronic pain. Some of these people have had this for years and years and years, and they've been to multiple doctors and multiple clinics and places, and they're no better. And then in my regular medical practice in my office, I deal a lot with people with fibromyalgia, where they have pain all over, and they've had that for years. And so when we look at trying to deal with these pain issues, you have to take a more functional medicine approach, a more holistic approach to defeating their pain, because just physical measures like physical therapy and massage therapy and things like that, they help temporarily, but they don't fix the pain at its source. So pain has its basis in inflammation. So when you have more inflammation, you have more pain. If you have less inflammation, you have less pain. So my rationale is to try to deal with the inflammation that people are having to reduce their pain levels. Many times as we do that, their pain goes away, or it'll at least go down 50, 70, 80%. Now, the changes that you have to make to reduce your pain, reduce inflammation, are all detailed in my book, Prescription for Health, Living a Balanced Life in a Toxic World. And if you haven't read that yet, please, I encourage you to get it, read it. It'll go into a lot more detail than what I'm going to be going into here. But let me just give you an overview of some of the things that I've found helpful to reduce pain and inflammation. First of all, you have to rid your body of obvious toxins. So what are we talking about? Smoking, tobacco, alcohol, drugs. Those things are totally pro-inflammatory, meaning they create inflammation and therefore increase your pain. You cannot ever get out of pain if you continue to smoke or drink alcohol or take drugs. It just doesn't happen. So that's one of the first things I teach people to do, is all these bad things have to go. If you plan on ever getting out of the condition you're in. Otherwise, you just stay taking pain pills forever and ever and ever and never get off of them. So those things have to be changed. Toxins are a very interesting subject because we're exposed to toxins all around us. There's toxins in the food, toxins in the water, the air we breathe, the homes we live in, the products we're using, the personal care products. So there's a lot of different kinds of toxins. And again, that's kind of the focal point of my book, is how to reduce that toxic exposure so that therefore you would have less inflammation and less pain. But let's go through some of the major ones here right now. So one of the most toxic things that you can do to your body is expose yourself through the foods that you eat. So what is the most toxic inflammation-producing food that we have? Well, you're not going to like this answer. It's wheat. Wheat is the worst thing that you could possibly be putting into your body. So what is so bad about wheat? Well, wheat is very pro-inflammatory. It causes inflammation. It's a very high glycemic food. So therefore it causes the stimulation of production of insulin from your pancreas, which turns sugar into fat. So wheat causes you to get fat and inflamed. In other words, there's nothing good about it. Why would you want to put it into your body? Well, wheat tastes good. We like wheat. We like bread. We like pizza. We like pasta. We like those things, but they are pro-inflammatory. They cause more inflammation and more pain. So one of the first things I have to tell people to do is to get off of all the wheat. Now, people equate that with going on a gluten-free diet, which for the most part, if you're not eating gluten, you're not eating wheat. But it's better to just look at eliminating all sources of wheat from your diet. So bread, pasta, pizza, cakes, pies, brownies, cookies, anything that's made out of wheat is going to be bad. And normally, most products that have wheat in it also have sugar in it. And sugar is very pro-inflammatory. So once you get rid of one, you usually get rid of both, and that can really help your body to heal. But if you continue to eat wheat, you'll stay inflamed and you'll continue to have lots of pain. So getting rid of wheat is important, and it's hidden in a lot of things, and you have to be very meticulous about reading labels and really looking at the products you're eating. In our next blog, we'll talk more about other things that you can do to reduce inflammation and pain through lifestyle changes. This has been Dr. Alan Gruning.